Hi, I'm Ken Cutbush. I'd like to talk to you about what to expect when you come in for a rotator cuff repair procedure with me. So, the biggest issue with rotator cuffs is that the surgery has the longest rehab of all of the operations that I do. The problem being that the rotator cuff tendons have this tendency to re-tear, and we have to go very slow with your rehab post-operatively. And then they take a long time to heal and get strong so that you can go back to doing what you normally do in terms of work and your pastimes. So you will come in on the day fasted. The anaesthetist will see you and put a needle in your arm and give you a general anaesthetic. You'll be out to it. We book usually about 2 hours of theatre time. We don't always need all of that. The surgery is arthroscopic keyhole surgery, won't be open surgery. And you'll be in recovery for about an hour or so afterwards. And then you'll be in hospital for one night after the operation. Overnight, the nurses are able to give you narcotic analgesics so that you get good pain relief. And the anaesthetist will often give you a block into your neck around the around the nerves, so that you've got really good pain relief. The downside of the block is you'll have a numb arm and often be weak in your arm until the block wears off. And the block tends to wear off overnight. And when it does wear off, you have to be a little bit thoughtful about it because the block can suddenly wear off fairly rapidly. And so when you feel it wearing off, you need to let the nurses know so that they can give you some tablet analgesics. The next morning, the nurses will change your dressings. The physio will see you and take you through my program for the rehab protocol, so you'll know what to do when you leave hospital for the first 6 weeks. And they should go through how to put a shirt on, how to have a shower, how to put your sling on. They'll stand you up and adjust your sling. We put the slings on with you in theatre lying on the bed supine, and they're actually best fitted with you standing up. And we can't do that obviously until you're awake and with it, and that happens the next morning with the physiotherapist. So they'll adjust and get it just exactly right for you. The sling should come down to your knuckles. It shouldn't end at the wrist. So if the sling is a bit too small, that needs to be checked and another sling got for you. Pharmacy comes up with your meds, and you'll get out of hospital about 10 a.m. the next morning. You're then in a sling full time for 6 weeks. You can take it off a shower and to change, but otherwise you've got the sling on for a full 6 weeks. And you can't drive during that period of time. One, I don't want you to because you risk pulling the repair apart, and because Queensland Transport state that they expect you not to drive for 6 weeks after a major upper limb operation, which a rotator cuff repair surgery would be. I'll see you back around about 6 weeks and again at 12 weeks post-op, both times with an MRI scan. We want to check that rotator cuff repair is intact. And we will upgrade your therapy exercise at the same time. We do those post-op visits with one of the shoulder physios from Extend Therapy. They're a very experienced shoulder physio, and they see all the patients that post-operatively, and they're very good at judging where you need to be with your post-op rehab. We will both write to your physio, and so everyone stays on the same loop and knows exactly what to do. Between 6 and 12 weeks, if you've got a big tear, I'll be asking you to wear the sling when you leave the house, but you can have the sling off at home. The issue with the rotator cuff re-tears is significant because the commonest time for a re-tear of the rotator cuff repair is actually between 6 and 12 weeks. That's the riskiest time. That's actually when most of them re-tear. So it is important to understand that. We have to protect your repair for the first 3 months, 12 weeks. It's a long time. So I'll see you back at the 12-week mark with a follow-up MRI scan. If that scan shows an intact repair, then we can all relax and we know that we can progress your rehab from there. So rehab really doesn't start in earnest until about 3 months in terms of exercise and doing things. Before then, it's all about rest and waiting for the rotator cuff repair to stick down and get some strength to it so that we can then do your exercises. At 3 months post-op, we'll start a more formal rehab, and we'll start some light strengthening then, and then we progress from there as you're able to. We're not talking about any sport until about 4 months, and that would be light swimming, provided you've got a reasonably small sort of tear. If you've got a big tear, it probably will be longer before we do anything at all. In the first 6 to 12 weeks, I recommend walking as exercise. It's very difficult to do exercise beyond that and not risk the repair. The problem with the repairs is not so much the repair coming apart these days. Often the repair will stay intact, and what happens is the tendon, because it generally is not, the tendon is sort of old and worn out in a lot of cases, it will tend to sort of shred off the repair and leave the repair behind actually, and then you have shredded tendon off that repair. So it's not just falls or a big significant event. Moving around and doing things on a day-to-day basis risks the repair coming undone. To get the repair to stick on and get strong, it needs to be still. Rehab will take for between 6 and 12 months for a rotator cuff repair. Often it's 6 months, but it's not unusual for it to be 12 months. And if you have a physical job, like a trade or something like that, or work in the mines, it is often 12 months until you're actually ready to go back to that sort of work. Heavy overhead work is a big strain on the shoulder, particularly the rotator cuff. And the rotator cuff does need time to not just heal on, but also to remodel and get strong so it can cope with that sort of work. And to get back to heavy sport, it will be somewhere between 6 and 12 months post-op. So that's what to expect when you come in for a rotator cuff repair. That's the overall framework, and that should give you an idea of what you're up for with the surgery.